Today we're going to focus on child development and the importance of the attachment relationship to learn more about how we can support children's positive development. The objectives of the presentation are first, to understand the importance of the earliest years, that is infancy and early childhood. Secondly, to learn about the importance of nature versus nurture, that is what a child comes in the world with, and environmental influences and parental and other adult influences on them that will have an effect on how they developed. Third, we're going to look at the concept of attachment and its importance for development. Let's start with physical development. Most parents and caregivers are familiar with physical development and what's important. Actually, surveys that were done by 0 to 3, National Organization for Infants, Toddlers, and Families, showed that parents were quite comfortable knowing how a child was going to develop physically. They had less knowledge and understanding of social and emotional development. So in terms of physical development, the progression that people are familiar with relates to motor development, that is a baby holding the head up, sitting, crawling, and walking, all of that occurring within the first year of life, and we'll detail some of the physical development in a later slide. How does this occur? Development is nurtured by a positive, trusting relationship with an adult. That relationship is extremely important in terms of a child learning behavior regulation, which we're focusing on here, as well as emotion regulation. And during the end of the first year, based on positive developmental interactions and positive physical development, as the baby moves into the second year, they start to explore their environment. However, what's very important to recognize is young children are much more comfortable exploring their environment in the presence of a trusting relationship. So let's look at emotional development. One of the things that we want to see in young children very early in development, in the first year of life, is a range of emotions. Much of the time, as we get into the second half of the first year of life, we'll see a range from alert attention, happiness, sadness, anger. Early on, you won't get as broad a range of emotions, but you certainly should see positive emotions as well as negative emotions. Then, through the relationship with a positive caregiver, a baby and young child learns to regulate their emotions. That is, to be able to soothe themselves when they're upset, to be able to look for comfort when they need it. And regulation is a very important part of emotional development, which we don't necessarily see in children who don't have a supportive environment. And all of the kinds of things that I mentioned above, the range of emotions and the ability to regulate emotions, comes from a positive attachment, a positive relationship with a caring, consistent adult. It doesn't have to be one person alone, but it has to be consistency in the caregiver. Social and emotional development is extremely important for cognitive development, which we're talking about now. So in order for a child to develop cognitively, they need to again have a supportive relationship. They need a parent or caregiver who will read to them, support their ability to learn language through reading and talking and being consistent with them. So with that good enough caregiving relationship, we see good receptive language, that is a child understanding when somebody talks to them, beginning actually in the beginning of year 2 and then going into year 3. And in year 3, we tend to see an emergence of expressive language. We get a little bit in year 2, but then you get a burst of language through the second year into the third year. At that point, a child will respond to questions. They can even talk about their thoughts and feelings and can understand others, and they can read cues from expressions on the adult's face. And what you see is a move from the second to third year into symbolic play. And what do I mean by symbolic play? That through a child's play, they can express how they're feeling, what they're going through. Earlier, their play is pretty routine, but then it gets more expressive in many ways going into the 3rd year. So, what do we mean when we talk about the amazing social infant? We talk about an infant that is ready to interact with other people. And one of the ways to illustrate this interaction is through the still face experiment that was developed by Ed Tronick at Harvard many years ago to show how even brief separations can impact on a child and parent's relationship. So what we see with the still face experiment is first of all face-to-face interaction with a very responsive mother. And when you see face-to-face interaction, you can see the baby smiling and laughing, she's smiling, so there's a very nice positive reciprocal interaction between them. This is a relationship that obviously has had a good history of positive development for this 6-month-old infant. Now you see the mother turning away, and she's going to come back with what we call a still face, without that emotional expression that we saw before. So what's the first thing the baby does? He looks away. He gaze averts. He's used to looking at her and getting a response, but here he's not getting any response. So he looks down, he picks at his clothes. Certainly you don't see that positive emotional expression that you saw before on his face. So he's still looking down, he's getting restless, and in a short while what you're going to see is he's going to start to cry. Because what the mother's done is violated his expectations for the relationship. This is a very short still face. It's less than 3 minutes. However, you can see him getting more and more upset. Maybe if he gets upset and cries, the mother will respond to him. And what you see is he's kind of breaking down, he's crying, he's kind of giving up, he yawns. And if he could talk, which he can at 6 months, he would be trying to tell the mother what's going on, but all he can do is cry, hoping that maybe with the crying, she'll respond. And you can see that his behavior builds more and more, hoping to get a response from his mother, which he isn't getting. And so now he just sits there, he's crying, he really doesn't know what to do, because this isn't the mom he's used to interacting with right now. What you're also going to see, it's going to be somewhat difficult for the mother, who's very responsive to him in her regular mode. You can see that she's having trouble with this as well. And in a minute, you will see her turn back and see what happens. Okay, now she's going to come back, and when she comes back and is responsive to him, see how long it takes him to settle down. He's crying now. She's going to turn around in a couple of seconds. Here she comes. Okay, first we see a smile between them. He's fussy, but he's smiling. And then what we're going to see is he kind of cries out. If he had language, he'd say, "What's going on, Mom? How did that happen?" But you can see they're back in their regular pattern within a couple of seconds. Now the second baby, 6-month-old, you'll see has already given up on his depressed mother. This mother, as we can see, is somewhat intrusive. She hasn't been responsive to him for the first 6 months of his life, and he's learned not to expect anything from her, because we can see that he totally gaze averts, that he's looking around. He doesn't look at her at all. He looks at the camera, he looks at other things in his environment, but he doesn't look at Mom. And you can also see there's no range of emotion. It's kind of this sad face that he has on, not particularly expressive. And every time he turns, he avoids looking at her. And we will see that eventually she'll say, "You don't want to play with me today, you're not interested in me." And she'll also say, "Are you more interested in the camera than me?" So it's very important to recognize that even a baby as young as 6 months old has been affected by a relationship that has not been positive. And one of the things that's important to recognize is that can be changed. That's one of the reasons that we focus on early intervention. But you can see at a young age, this baby has given up on at least this relationship. That doesn't mean that if there were another relationship, if there were another person who was more responsive, that he would not react that way. We really don't know. We just know that for this relationship, he's not going to respond. So, as we continue, we learn that the development of intelligence, emotion, and social skills is highly interrelated. We talked about physical, social, emotional development. We illustrated in 6-month-old babies how you already see difference in relationships depending on the reciprocity, that is the availability, emotional availability of the caregiver. And one of the things that's important to emphasize is that how children feel is as important as how they think. And how they're treated is as important as what they're taught, particularly in relation to readiness to succeed in school. So one of the things that's very important to emphasize is that emotional development and social development is just as important as other aspects of development in order to support cognitive development in school and the ability to learn. So what do we mean by attachment? The definition they talk about an unchallenged maintenance of a bond that's expressed as a source of joy. John Bowlby, first wrote about the attachment relationship, and you can see what he wrote, that attachment is behavior that results in a person attaining or maintaining proximity to a clearly identified individual who's conceived as better able to cope with the world. So going back to the still face, we saw that the first baby really felt like his caregiver was there for him, able to take care of him, able to help him learn about the world. The second baby had already given up on that. And the relationship with the primary caregiver lays the foundation for subsequent well-being and later relationships. That is, that early relationships form the basis of all later relationships. And that's one of the reasons that early preventive intervention is so very important. So attachment grows and develops during the first year of life. For the first 3 months, there's limited discrimination between attachment figures. However, you find even in the third month, second month to some extent, third month, they start to differentiate the very familiar adult, like the mother or the father, and they can differentiate by smell, they can differentiate by voice, even footsteps that they might hear when their primary caretaker is coming. Discrimination is limited by cognitive immaturity, but one of the things that also is important to recognize is the physical characteristics of the baby are very important to attract this relationship with the caregiver. So between 2 to 3 months and 7 months, baby becomes more socially responsive. We all know the social smile that comes in, usually 2 to 3 months. Some people like to say it's gasp, it's actually a social smile, and you see that come in. We see an increase in eye contact, just like the eye contact we saw with the very positive relationship during the still phase. We see sounds, cooing, interacting, and play. And we also will notice a baby starting to interact differently with different people in terms of the kinds of relationship they show, being more comfortable with the primary caregiver or caregivers. Now, what happens at 7 to 9 months is the beginning of stranger anxiety, where babies clearly prefer familiar caregivers. We call it a time of focused attachment. And they can start to not only look wary if approached by a stranger, but really protest and cry if a stranger comes near them. And it can come on very suddenly, but it's very normal in terms of development because it means that they have a very good relationship with their caregiver. And that's when you also start to see crying and protest when they're separated from the primary caregiver. At 12 months of age, they're clearly attached, and the attachment figure becomes what we call a secure base or safe haven. So they will move out from the secure base to explore their environment. But if they don't have that explore base, they may be more hesitant to explore their environment. So the secure base is very important. And when they can look back at the caregiver or move back to the caregiver when they've moved away a little bit, they feel a sense of security. And that's what we mean by a clear attachment relationship. So what are children learning during these years? They learn what they can expect from their primary caregivers or their attachment figures. On the one hand, they may learn that they'll be picked up if they cry, if they reach up with open arms, or they might learn they'll be left alone to cry. And I know that some strategies in terms of sleep problems and others are leaving babies alone. And sometimes that seems to work well, but basically babies learn who's there for them and when they're there for them and what they can depend on, and whether they can feel secure that the caregiver's there. And you certainly know with young children, when you change their environment, it can be difficult for them. And we even see that through the still phase, a brief change and how that affects them. It's very important for a caregiver to be consistent. Certainly caregivers can't be there all the time, but the baby needs a routine and they need to know what to expect in the early years. And what facilitates secure attachment? We've seen that. Warm, sensitive care, nurturing, consistency, a dependable caregiver. One of the things we haven't talked about is emotional support for the caregiver. And there are times that it's very important for caregivers to also have emotional support. More isolated caregivers who are trying to take care of children on their own can get overwhelmed at times. So emotional support is really important. And what we call this a secure base. And with the secure base, infants and toddlers develop well, they explore their environment, they come back for what we call emotional refueling, and then they go out to learn more about their environment. So the assumptions that come out of what we're talking about is that a baby functions in a relationship, and we need to understand not just the baby, but also the relationship and how to support that relationship to optimize social and emotional functioning. So what about risk factors? Certainly there are going to be risk factors related to development that we can't always have a smooth path. And many of us work with young children, infants, young children and families who've witnessed violence. They may have witnessed domestic violence or violence in their community. Certainly within the child welfare system, babies have been abused and neglected. One of the things actually that's very important to recognize is that the majority of the children in the child welfare system experience neglect. Not that they don't experience abuse too, but neglect is much higher, which is probably also related to substance use and substance abuse among caregivers, mental illness, and resultant prenatal care, lack of prenatal care, that is a significant risk factor as well. With poverty and low socioeconomic status, that doesn't necessarily mean that's going to be a serious risk factor, but it depends on how much support there is in the environment. And with increased risk in the environment, lack of economic resources, comes more stress and other types of things. So that's certainly a risk factor. Young mothers, teenage parents who may not have much support, who are parents before they're ready, maybe in a difficult relationship to begin with, creates more risk factors for the baby and the development of the child as well as themselves. I mentioned domestic violence, and that's obviously a risk factor in the relationship, but also children witness domestic violence. They're not in the other room sleeping, even though we think they are. They may be in the other room, but they hear what's going on and they experience the stress in the environment. I already mentioned about child welfare involvement, and then there's also parent criminology, where infants and young children experience one of their parents being in prison. So what are the signs in the baby that emotional needs are not being met? This builds on everything that I've said before, as well as the observation of the still face. We see sad or bland affect, not the range of emotions that I said is so important for normal development. A lack of eye contact or avoidance of eye contact. We also see non-organic failure to thrive. That is a baby who doesn't grow and develop well based on emotional reasons as opposed to food or something else. Non-organic failure to thrive relates to neglect and baby's kind of giving up. See a lack of responsiveness, as we saw in that second still face illustration. You also see the infant preferring a stranger to familiar caregiver. Some babies and infants are more friendly than others. However, a preference for someone they don't know, a stranger, as compared to the familiar caregiver, indicates a risk factor. And then a baby that doesn't want to be held or touched. Although there are sensory motor issues that can relate to that, it more likely is a risk factor related to their caregiving environment. And for a toddler or preschooler, we see the most common thing you see is aggressive, dysregulated behaviors. You can also see withdrawal, and you tend to see withdrawal more with child sexual abuse. But dysregulation is a good indicator of emotional problems. That isn't to say that all babies and young children, toddlers and preschoolers are steady, but being particularly dysregulated may be an indication of some difficulty in the relationship. Also, you see problems with and deficits in attention. A lot of people talk about attention deficit hyperactivity disorder, ADHD. And one of the things that's important to bear in mind with ADHD is that some babies and young children have difficulty paying attention and are not ADHD, but that exposure to trauma, the kind of risk factors we're talking about, can lead to the dysregulated behavior that lead to that diagnosis. And then lack of attachment, I mentioned preferring strangers to a familiar person. Sleep problems, sleep disorders, feeding problems, all of those can be a sign of emotional problems. That isn't to say that in the normal range of behaviors, children vary in their sleep behaviors and eating, but when it gets to be an extreme, it can be a sign of emotional problems. And caregiver problems that we need to pay attention to are substance abuse, addiction, mental health issues such as untreated depression, domestic violence in the family, and then another issue that people don't tend to pay enough attention to is the parent's own past history and whether they've had their own abusive or neglectful experience, because parenting comes naturally, but it comes naturally the way you learned it. And if parents have a history of poor parenting themselves or abusive behavior, that's what they bring to their own parenting. And that's something that they can receive help with. And then finally, emotional unavailability resulting from trauma. So sometimes we see parents that are physically present with their child, but not really emotionally present because they're not able to be emotionally present. And also, you can hear me emphasizing that we're not just looking at the child or not just looking at the parent separately, as we're putting more focus on the relationship between them and how important that is for the infant and young child's development. Some of the settings that we see for interventions, I've referred all along to the importance for intervention early, and it's very important to intervene if one can before the problems become more difficult when the child gets into the school system. Child welfare system, where children are adjudicated dependent for abuse and neglect, and there are some very excellent programs now working with young children in juvenile court to help them and their families when they've experienced abuse and neglect. Child welfare relates to child protection system. The foster care system is another important setting for intervention for the young child. A lot of work's done in child care and infant care centers. It's an opportunity for intervention where children are and parents can come in if they're hesitant to come in for help in other ways. And also for those of us who work in mental behavioral health, we try to find places to intervene that will destigmatize it and make it easier and more comfortable for parents and children. Early intervention programs, another opportunity to work with young children and families. And then another area that's increasing in frequency and extremely important is integrating mental and behavioral health in pediatric clinics and primary care clinics. We talk about doing what we call a warm handoff to a behavioral health clinician when a pediatrician or primary care doctor identifies a mental health issue that could be addressed. And by integrating the care in the clinic, again, it destigmatizes it and becomes a part of their care. And also, it's a place where they go for care in general. And it's a way to expand the kind of care that's available. Major message from this presentation is that prevention and intervention must start early. So some of the people, some certainly juvenile judges, but even in school systems and an alternative school system, we see aggressive, difficult behaviors in adolescence. We see truancy, delinquency, problems at school. One of the things to recognize is this started earlier. It doesn't start in adolescence, so we really need to recognize that those difficult behaviors that we see in adolescence are as a result of earlier experiences, and so it's very important to intervene as early as you can. That doesn't mean that you can't make a difference in adolescence, but early intervention is very important. It's very important to have special interventions and programs for abused and neglected infants because they're at very high risk for poor outcomes, both emotional, cognitive, even physical. We even see delays in development related to abuse and neglect. So we know that early interventions can make a difference. We have good data to indicate that. What we know, rarely the case a maltreated infant has no symptoms. And by the way, early intervention is also very cost effective. For the amount of funding that's put into early intervention, you're preventing more serious difficulties later on. We also know that planned interventions increase odds for favorable developmental outcomes. There's good evidence to indicate that. And we haven't said a lot in this presentation about brain development, but it's very important to understand that trauma and other negative experiences affect the developing brain, but that the developing brain can compensate and can change with good intervention and early intervention so that you can have recovery from early deprivation with good early intervention and recovery in the brain in terms of the more positive connections that are made as opposed to negative. Further, lasting early intervention decreases later problems. We have good evidence to know that too. Finally, an infant's rapid development is a strong force for progress and builds not only maternal self-esteem, but also builds the infant's self-esteem, because what the infant thinks about him or herself in the first year of life relates to the kind of relationships they have and what people think about them and how people relate to them, and then they start to think well about themselves if they have positive relationships and maybe less well about themselves if they don't. So also early intervention helps the parent tune into the child, be able to read their cues and respond sensitively and appropriately. So here we've provided a presentation about development and what makes a difference and what's important in the earliest years, and also the strong message that early intervention can make a difference for later development. Thank you.